stand by me, stand by me. And that's what you guys have been doing. And a big part of this community is getting feedback from you guys and understanding what your takeaways are. And as you know, as far as the healthcare system operating effectively, the engine behind it, we all know that the engine behind it are the
nurses.
Yes.
I learned that.
Yes.
I knew that.
Yeah, we keep things running, and I use that very intentionally to say one of the key takeaways that I hope that people will understand is that the reason why I like to use that phrasing as far as nurses being the engine of our health systems, number one, they're closest to the suffering. Number two, they see people in the context of their lives and in their communities and in the context of the environment, which I hope you will enjoy the beautiful view of the ocean right there. But that also, the reason I use engine is because when you think about an engine, you have to take care of the engine. You have to feed it. You have to make sure that you protect it. And so all of our healthcare teams, we really have to make sure that we're doing that. And that's part of what we wanted to do this morning, is to have a moment to hear your takeaways, what you've been experiencing. And I am looking for our favorite redhead. Where is she?
Oh, she just went to the
She just, bio break. Yeah. Dutch, they are so direct. Yes, I do know. David? Yeah. So she has been, I don't want to steal her thunder, but she has been taking an enormous amount of notes and takeaways. And some of the ones that we'll wait for her to get back. But what we wanted to hear from you guys, that's why we've got these microphones set up, is we wanted to hear your takeaways. So you can speak now. I was just guiding you. Well, the microphones are for you guys too, but we had asked Tasha to go ahead and share some of the things that she was taking away as a prompt. I'm gonna, Sheena, please come on up here. I'm gonna be very, and I'm gonna ask Sheena, so can you, yeah, thank you very much.
Just grab the mic.
Yeah.
And one small piece of homework, we want to get all the crowdsourced insights from all these sessions, and we'll put them together into a share. So homework is to actually synthesize in the next few days what you've taken away. We want to put it all together. AI can help.
Yeah.
Hi, everyone. Oh, that was loud, sorry.
And introduce yourself, please.
I'm Sheena. I'm a pediatric clinical nurse specialist. I work for Kaiser Permanente in the Northern California region. And I work in the quality and safety department. And quality and safety has really been like my bread and butter my entire nursing career. But about a year ago, I sort of discovered I was living under a rock, and I knew nothing about the advanced technologies that are available to us and to our patients in healthcare. And the way I discovered that is my dad actually, he's been sick for many, many years. And he started using ChatGPT to help himself and to prompt his physicians to help him get the right care. And so I discovered AI Med, and then that's how I discovered NextMed, and it's really exciting to be here. I think my biggest takeaways really are that it's at some point, advanced technologies are going to be the standard of care. So like we cannot say that these technologies are available, but we're not implementing them. We have to implement them. And so my gut instinct is to go back and spread the word. I cannot go back without sharing this knowledge because, once you know, you can't go back. And so I feel like sharing it with not only my partners in nursing, but physicians and also patients. And so I'm looking at some patient advocacy type work, trying to help spread the word for patients so that they feel like they can trust it as well. And I think those are some of the key areas to focus to help move this along.
All right, if you know, you know. Please introduce yourself, because I don't want to take credit for all of your great work. And she actually, when I do, can you go back and forth on these, right?
Yep.
So we have several of them, so I'm just giving you a sense. Is there one of the takeaways that, first of all, introduce yourself, tell us what you've been doing here.
Okay. Hello, everyone. So my name is Tiasha Zaitz. I'm the host of Faces of Digital Health podcast, so I'll be writing some more summaries in the Faces of Digital Health newsletter. And I guess, to me, my takeaway, two big topics are kind of the takeaway for me. One is AI. I love how we systematically went through, the progress in generative AI, in agentic AI, and especially how we can use it as patients, thinking about how, I use AI a lot in my daily work to just help me summarize things or to give me feedback, but I never really thought about, uploading medical information and say, act as a gastroenterologist, act as an endocrinologist and give me your perspective. So that's definitely number one. Then the second one, especially around aging, longevity, I loved the down-to-earth approach from Eric Topol, because as a European, we're also tend to be a bit skeptical, and I always like to think of the healthcare system's perspective. And from that point, when it comes to increasing health span, I think we've got a lot of power and information at the moment as individuals. So that's good. Like, we can do a lot on our own, but when it comes to the healthcare system's perspective and how can we integrate that into the healthcare system, I think that's the big next challenge that we still need to work on.
And for all the ovaries in the room, what's a key takeaway on the health of women? And I was just saying, I am very intentional about calling it the health of women, because women are more than our reproductive organs. We've got hearts, we've got muscle, we've got all sorts of skeletal systems, so the health of women.
I'm actually quite worried because of the recent developments that we see, with science, research, and funding. So I spoke with Jennifer Garrison. I think she's also here. And I'm going to publish that short interview with her. But like, just knowing that, there's still so much that we don't know about women's health. And if you find initiatives in Europe, that's the Women's Brain Project. It's a Swiss a non-for-profit that basically tries to do research on women. And that's kind of where I see that we should maybe contribute as individuals. So basically with financial donations, so that the research happens if, the public mechanisms are not going to be there. But yeah, definitely, Okay.
Who are the quiet people in the room who frequently don't share what's in their heart and mind? You can, okay. All right, Harold, why don't you come and share? And while you're doing that, David Klein, if I could get you to roll the beautiful illustrations of our community that Dave Zaboski, where I see you, love you. While we're speaking and we've got the community, I want you to enjoy the visuals of the illustrations of what our community looks like while we are listening to some of your takeaways.
So, I've been coming here, I don't speak much, but I've been coming here since 2018. And I took this picture over in the Innovation Lab. And it says, how will you positively impact 1 billion people? So I'm on a quest and a vision, and I believe in 5 years, I'll be touching 1 billion lives. For those who came by my booth, you may not have maybe understood what I did. Anthony Chang spoke about, wouldn't it be nice the day that you used AI, but you didn't know you're using AI? And that's what I have. The ability to simply, so have to say, it's been 13 years of my life to create something that's going to make a difference. So I'm a practicing anesthesiologist. I've probably taken care of more than 35,000 patients. And for me, it's a personal mission. Everyone's mentioned a lot about errors in healthcare, but did people realize it's the 3rd leading cause of death in the United States? I mean, I'd just like to see people raise their hand and say, how many of you have known someone, a loved one, or heard of a story where someone got admitted to the hospital and had something go terribly wrong? Mm-hmm. I'm one.
Yeah.
But who's doing something about it? To
The
me,
nurses are, I can promise you.
Oh, no. I mean, that's right, but how do you solve the problem? So I actually graduated UCSD in biomedical engineering. This is an engineering solution. And you know what? That year in 2018, there was a workshop here called Moonshot.
Yeah, Jack Hittery.
I went there and said, I have a moonshot. And you know what? It's taken all these years to actually make it come true. And what we have is an agentic AI platform that regulates AI. No one's actually talked about how do you regulate the system? How do you make it medically regulated? but the reality is it's real time at the patient's bedside where patients die. This is going to change everything. And just to say, you know what? I believe in May, it's been a long time. The first phase of this I'm doing with GE Healthcare, the Saudi Telephone Corporation, for the Saudi Ministry of Health for the Saudi Virtual Hospital. Phase 1 is 59 hospitals, 300 ICU beds. Phase 2 is close to 200 hospitals, 3,000 ICU beds. You know, I want to do a shout out to 2 animal scientists here, Juan and Juan. They came up to me and they're telling me that they do large-scale agricultural. They deal with like 1 million hogs and chickens. They actually gave my my partner, who's the AI scientist, Vedran, real data yesterday. We're going to actually run it through the system so they can use these tools to actually monitor the health of the food that we eat. Okay? I also want to give a shout out to Sai. He's an engineer from India. And believe it or not, this very first, I didn't know till yesterday who he works for. So there's a Dr. Ravi from India, a transplant surgeon who has some hospitals. He sold them. And I met him in 2018 here. And you know what? He wants to partner with us to bring this technology to India, and we're going to make these hospitals AI ready. So the value of the work that you two do is not just conceptual. It's along, you know, it's, for me, it's baby steps, right? And you see the future, and you have to believe in it. And for me, it's not about making money. It's about this. How do you impact people?
Thank you for that. I was going to say thank you for that. And one of our favorite things is that we hear from people that they met somebody here, they had an idea, it changed their career, they started a company. Did you have an insight that you wanted to share?
And on that point, what's your moonshot? What are you going to come back with next year? And leverage the folks in the room and beyond to enable that. And Harold's a great example of going from inspiration to action to impact.
And a level of loyalty and commitment to this community. So thank you for that. Thank you. All right, go ahead.
Thank you, Dr. Lucian Engelen, for encouraging me to come up here. First thing I'd like to say is this is my 4th time here, and I am a stage 4 metastatic breast cancer survivor. The first time I
Can we give you a round of applause? We are so glad you are here. Thank you.
To tell you the truth, this is my 4th time here. I was here in 2013. I was still in the middle of chemo and bald, and seriously, this has really helped to save my life. Thank you, Dr. Daniel.
Thank you.
Now, I want to talk about trust. There's a quote that's been said over and over again, that innovation moves at the speed, not at the speed of technology, but at the speed of trust. And we talked about it in the very first workshop with Dr. Anthony Chang, how doctors can be trusted when they really know how to use AI. And AI can be trusted when when doctors validate AI. But I think there's something wrong with this equation because I am a student of decision science. Decision science is a matrix. It's bidirectional and multidirectional. And the missing piece there are the patients. How much do physicians trust their patients? How much do the developers of technologies trust their patients? And the reason why I ask this is because I see a lot of technologies and conversation about how physicians use AI. But since I have been coming here, I'm now a graduate student of public health at Imperial College London, studying health innovation and data science. And I could potentially take all my life course data, put it in an AI, create an AI agent, and collaborate with you. But will you trust me? The thing is, there are many of us, we are the most ravenously motivated to get the information. And we are a brain trust that I think the smartest inventors, developers, and physicians can really, you can use us as a resource. And I think The second part that I would say is, aside from this, thank you, Dr. Lee Sanders, for the public health,
He's right there. You can thank him right there. Yeah.
for the beautiful, loving, and exciting, creative great breakout group. Because aside from this development, the thing that we really need is to get it to the last mile. Because 7 years ago, I was here, and there was open water. There was all these amazing, small footprint, beautiful technologies, but where it's not available.
I was just going to say thank you so much for reminding us about the enabled and the empowered patient. I actually think of them as the experts in the condition, so thank you for that.
Thank you.
Thank you.
And
Thank
one
you.
last thing, Filipinos, I'm a Filipino from the Philippines. 18% of the nurses in California are nurses, are Filipinos.
Yes.
Use us as innovators as well in the Philippines.
And they are damn good nurses.
Thank
for
you.
that. Thank you.